Thank you, Roland. Of course, it is almost time to head back to school. First day of school is Monday for thousands of South Florida children. But will your child be able to see what the teacher is writing down on the board? More than 12 million children have some sort of vision problem, and 80% of preschoolers don't get a vision screening. Local 10 News health specialist Christy Kruger looks at the important and simple exam.
10-year-old Jocelyn Campo-Danico is sporting a new look. Glasses.
I did not know if my eyes were bad or not because I never looked from anybody else's point of view of things, so I always thought my eyes were fine.
Her mother recently noticed Jocelyn was struggling to read.
It truly was reading like that, so that I was like, you know, there's something wrong.
I want you to look right here at my finger for me.
Dr. David Rand says correcting vision problems in childhood isn't just about reading. From birth to the age of 12, he says the brain is developing visual pathways that will have lifelong effects.
During those years, if the visual system does not develop adequately, for example, if there's a visual disorder that may limit the vision, the brain will not even recognize the vision that the child has the potential to see, and permanently will not develop that system to the best possible potential.
The most common types of eye problems in children are nearsightedness, crossed eyes, and lazy eyes.
Even if the vision is good in both eyes, if the eyes don't work well together, the child may never develop the appropriate depth perception, which is as a result of the eyes working well together during those essential childhood years.
In some cases, surgery may be necessary to correct a problem, but for most kids, glasses will do just fine. They have made a world of difference for Jocelyn.
Like the first day, I'm like, wow, your vision's perfect.
She's a little more part of the world now because she can see it. It's easier.
And that was Christy Kruger reporting. She tells us that eye specialists recommend preventive eye exams at the age of 6 months. 3 years just before kindergarten, and once every 2 years after that, starting at age 5. Now, once your child has been identified with a vision issue or problem, it's important to get them the right fitting glasses. That's the focus of Optiwow. That's a new internet-based optical shop dedicated to kids and teenagers. Pediatric ophthalmologist Dr. Roberto Warman says it should eliminate many of the common problems.
Glasses that are too big for their face or too small, or misaligned, or they use the wrong lens, or we order something and they send something else. So pediatric ophthalmologists tend to have their own optical, if possible, because of that, to make sure the kid's eyesight develops well.
And in some cases, with proper correction and early detection, kids can outgrow their vision problems, possibly eliminating their need for glasses later on.